Hello all, thank you so much for joining us today. We have some news to share from Vermont DOC, which you may have seen from the press release that we sent out. So I'm going to begin with asking everyone, as I've seen you've done, is mute your phones, please, and also please turn off your video. When I call on you for questions, if you're a member of the media, please feel free to turn on your video and turn on your audio, obviously, to ask those questions. I am recording this, as you notice, and we will get this posted to the Vermont DOC website as soon as possible. This will be on our YouTube page, so I will send out a link to everyone who RSVP'd to this meeting to that as soon as it's posted after the meeting. So I will begin with this overview, then Commissioner Baker will speak, and then we'll open it up for press questions. So without further ado, as you have read, we have 85 positive cases among the Vermont inmate population at Tallahatchie County Correctional Facility in Tutwiler, Mississippi. 84 of those were identified through testing that is still underway at TCCF by the order of the Vermont Department of Corrections. One of those 85 was the inmate who tested last week, who was positive. The testing was triggered by that one inmate. They are testing positive last week, and the 6 inmates that tested positive upon return to Vermont. They returned to Vermont to Marble Valley Regional Correctional Facility in Rutland on Tuesday, July 28th. They were tested per DOC protocol immediately upon arrival, and they are positive, so if they were negative, they would follow then a 7 and a 12-day protocol. These test results from Marble Valley came back Wednesday evening. Immediately after these test results were received, contact tracing and communication began immediately, and inmates were moved from medical quarantine to medical isolation. As I mentioned before, test results from Tallahatchie are still pending, and the following numbers are still awaiting final confirmation. Right now, we have 84 positive tests of the people who were tested beginning on Thursday. Roughly 30 of those are negative, about 90 are still pending, and we hope to have full test results today or tomorrow, and we will be communicating that. So without further ado, I will turn it over to Commissioner Baker, and then we will come back for press questions.
Thank you, Rachel. Good afternoon, everyone. Thank you for joining us. What I thought I would do is start with a timeline to put into context what we're dealing with in Mississippi at Tallahatchie County Correctional Facility. Then I'll talk about action items that we have taken and a process that we have implemented to manage what we consider to be a very serious situation. Monday, July 27th, 6 inmates from Vermont left Tallahatchie via van transport to be transported back to Vermont. They were coming back either because they were coming towards the end of their sentence, their minimum, and preparing for transition back to the community, or they were coming back for programming in order for them to be prepared for transition back to the community. The inmates arrived on Tuesday the 28th after the journey from Mississippi, and they were brought to Marble Valley Regional Correction Facility in Rutland. Per our protocol, they were quarantined and tested as we do all new entries into our system. We were already aware of the fact that one inmate from Tallahatchie had tested positive and was exhibiting a symptom of the virus, which was running a fever. One of the inmates that came from Tallahatchie also presented in Rutland with a fever. The 6 inmate tests were returned on the 28th of July, and all 6 were positive. Those inmates were immediately placed into medical isolation according to our protocol and had been taken out of quarantine. And we started contact tracing with our emergency response team, which is part of the Vermont Department of Health and the Vermont Department of Corrections, to identify contact and identify who we needed to follow up with. We immediately notified CoreCivic of these positive tests, and on Thursday the 30th, we met and had several conversations with CoreCivic and directed them to start testing the Vermont inmate population in Mississippi. Mississippi's protocol, not CoreCivic's, but the state of Mississippi's protocol is to test symptomatic, not asymptomatic individuals. On a phone call during the day on the 30th, we began to realize that CoreCivic and Mississippi may not have capacity to do the testing that we were requesting. Through a series of phone calls and working with our partners here in Vermont Department of Health included, them making contact with the Mississippi Department of Health, we're able to start to identify the capacity to do the testing. So testing started on all the inmates on the 30th of July. The testing consisted of testing 202 inmates. Some of those results went to the state lab in Jackson, Mississippi, and others went to a private lab in Texas that our contractor CoreCivic uses. The beginning of the testing of the inmates were the test kits that CoreCivic had, and those test kits went to their contractor lab in Texas, and those are the tests that have not returned yet. We also did contact tracing to identify the 4 drivers who were involved in the transport from Mississippi, and made contact as part of our protocol on contact tracing. We met with the team at Tallahassee late in the afternoon of Friday the 31st and started directing them based on our protocol that we had provided to them prior on how to cohort the refusal and treat the positive tests. On Saturday, August 1st, there were 2 phone calls with CoreCivic. The first one was at noon and the second one at 5 p.m. As a result of that, we had gotten the test results back, the first round that Rachel had identified to you, the 84 positives and the 30-some negatives. We began to establish an incident command system relationship with the folks at Tallahassee, and we built action items and set expectations on CoreCivic about what we wanted to see. Some of those action items were the immediate separation of the negative inmates from the positive population, follow-up testing for the folks that tested negative at the 7-day mark. We insisted on staff testing, which I'll touch on in a minute. And we also started to put in place protocols that mimic our protocols here when we have a positive test, to include oxygen checks, saturation checks 3 times a day, and temperature checks on the inmates who are positive 2 times a day. And we also started requesting that CoreCivic reach out for medical surge capabilities of the hospitals in the area, to include ICU capacity and the ability to handle acute patients if it developed to that point in time. Yesterday, on Sunday, August 2nd, we began the daily phone calls, 2 separate phone calls, an overhead operation phone call to understand exactly what CoreCivic is doing to deal with our population there, and also a medical call, which is starting to individually identify each positive case and discuss with our medical team, both our Director of Nursing and our Director of Medicine, Dr. Scott Strenio, to start talking about working and understanding the situation with each individual who's positive. As I speak, there is no one who is symptomatic with symptoms that concern us that require the next level of care. We also directed CoreCivic to put 24/7 RN staffing on duty at all times. I'm expecting that Commissioner Levine from the Vermont Department of Health will be speaking with the Mississippi Commissioner of Health at some point to make them aware of the mass outbreak inside a jail system inside Mississippi. Today, August 3rd, we reached agreements with CoreCivic to test all their staff. A tabletop drill is being conducted to test the protocol that has been updated specifically for CoreCivic in Mississippi. That was done by our staff here. And we've established the family and friends support team. We've expanded that team in order to be able to have family members reach out and check on the status of their loved ones. So with that,
It looks like we may have lost the commissioner temporarily. Please hold with us for just a second.
Rachel, I'm back. I think that's the first time I've been thrown out of my own press conference. So
It wasn't me, sir. I think it was the internet.
So what I started saying is that I just want to touch on a couple pieces of what we're insisting for medical care. We want to make sure that all the negative inmates are tested in 1 week. We're working to identify an independent medical monitor to put in place in Mississippi to give oversight to make sure the inmate population is receiving the best possible care. We are talking about making sure that they do get through their staff testing, because it's our belief that the possibility of the virus inside the facility came from a staff member coming into the building. We're talking about continued communication with hospitals and checking on a daily or at least bi-daily basis their capacity to be able to handle the patients. We're also requesting that CoreCivic pay particular attention to mental health needs and the mental health well-being of the inmates that are in custody in Mississippi. Our chief nursing officer, Heidi Fox, our director of nursing, is cross-checking vulnerable population lists right now. And we're depending on figuring out what the most vulnerable inmates are there to create care plans for them. And we're also doing on a daily basis, walking through with the medical staff and our medical staff, the care plans for each inmate that has tested positive. And that's being run with an overhead management team based here that we have virtually inserted in the process subject matter experts that we have here on our staff who have done a remarkable job of keeping the virus out of our facilities. So with that, this is an overview of what's going on as a result of the test coming back positive at the end of last week. And I'm going to turn it back over to Rachel to start managing questions that have come in from each of you, the media.
Thank you, Commissioner. As I said before, when you have your question, please unmute yourself and turn on your video if you would like for the purposes of the recording. I'm going to go in the order of RSVPs. So we're going to start with Ross from WPTZ. Ross, are you here?
I am here. Can you hear me okay?
Yes, we can. Thank you.
So quick
Good
point
afternoon,
of
Ross.
Good afternoon. Thank you for your time. So just a point of clarification. So all of the safety protocols that have currently been in place at DSC's facilities here in Vermont, those same protocols have not necessarily been in place for the same amount of time at the facility in Mississippi, correct?
what I would say to that, Ross, is they have been provided all along the updates as we updated protocol. The challenge there has been the capacity to test in the state of Mississippi.
So, it is new that the state is, other than just providing the update, asking them to be doing more. Is this the first time that the state has had to ask the facility to be doing more?
I don't know if it's the first time in the state, but it's clearly the first time that CoreCivic and Tallahatchie County Correctional Facility has requested support from the state health department to do facility-wide testing of the Vermont inmates.
So I guess my only other question would be then, do you feel it may have, in hindsight, may have been short-sighted to not request these protocols be put in place earlier as a preventative measure?
What I would say to that is that hindsight being 2020, there's a few things that I wish could have been done to include tabletopping and testing the system. Our focus right now is putting all our efforts into making sure that the medical care that needs to be delivered to these folks is delivered to them. As I told staff in a meeting earlier today, these folks have been victimized by the virus and they need to be treated as their victims, and they need to be taken care of with the highest level of care we can give.
Thank you.
Thank you, Ross.
Okay. Next up, Lisa, Associated Press.
Good afternoon, Lisa.
Hi, Commissioner. So going forward, what's going to happen here? You mentioned that CoreCivic follows, I guess, Mississippi's rule that you only test for you only test symptomatic inmates, right? So, I mean, is that or are they going to change that for the Vermont inmates in the future?
So thanks for that question, Lisa. We are going to put Tallahatchie in the rotation that we do in Vermont and treat them as if they're a seventh facility in Vermont and put them into the rotation for mass testing on a regular basis.
Okay. And just a little background, how long have we had, is it about 2 years that they've been held in Mississippi?
I believe we've had a contract with CoreCivic since October of 2018. It'll be 2 years
Okay.
in this coming October.
Okay. And do you foresee any other inmates coming back from Mississippi anytime soon?
Do I foresee that? We are in conversations to determine the most vulnerable folks if we have to make a move to get them back, to be sure that they're in our system here. The challenge with that, Lisa, is that we've had to work to thin out the population here, and every time we add population, we're waiting for the potential that the virus is going to pick up steam here in another month. So it's a very delicate conversation. It's not off the table, but a decision has not been made yet.
Okay. Thank you for your time.
Thank you, Lisa.
Okay. Next up, we have Eric from the Times Argus.
Good afternoon, Eric. Good afternoon, Eric.
Good afternoon. So I guess I'm still unclear. Why wasn't the Mississippi prison already part of the facility grouping with the testing? Why wasn't it already treated like a seventh facility, considering Mississippi has been in much worse shape than Vermont over the course of this?
The answer to that, Eric, is that they followed the state protocol of testing when symptomatic and the capacity to be able to test. We had to spend a lot of time between Thursday and Friday just getting together the amount of testing supplies that we needed and working out capacity at a lab to test it. Not an excuse, but a reason.
And so those, I think it was 16 that refused to get tested. What's happening with them?
It's no longer 16. I believe, and Rachel, correct me if I'm wrong, I believe we're at 8 now, but they followed our policy. This is not unusual for us here in Vermont to get folks to refuse to take a test. And when an inmate refuses to take a test, we treat them as if they're positive, and we get them into medical isolation because we don't know. And some of that reasons for here in Vermont for refusal is we test the facility so much, it's not a pleasant experience to go through. So we asked them in Mississippi to treat them the same way that we treat folks that refuse here. And we're down to 8 folks who have refused, and they're medically isolated. And as a side note, those individuals were in, isolation by their own choice anyway. So it's not like they were moved into isolation.
And one last thing, for the 202 inmates tested, are you still expecting results from that? Like, could this number be higher than the 92 total so far?
Look, Eric, I'm, as the commissioner who is statutory responsible for the well-being of those 219 people in Mississippi, I'm very concerned about what these tests are going to show us when they come back. You know, I don't think anybody on this call or any of the media can't figure out the math of what we've tested so far and what's positive. So I'm very, very concerned, and we're working feverishly to try to deal with this from a medical standpoint.
Thank you.
Thank you. And Eric, that is correct, 8, but that is our last update. So these numbers could change at any point. Next on our list, we have Mike from the Islander.
Good afternoon, Mike Donahue.
Mike, are you here?
Yes, I think. I mean, for me, the Berlin one would be easier. You go that way and come back the other way because it's flatter. But
Okay, we'll return to Mike. I would just ask that everybody who is not being called on, please mute themselves. Thank you.
I'll come back. I'm going to come back the Montpelier way. I'm not going to come back over the gap.
Please 1 minute while I work out this audio. Okay, good. All right, next up we have Adam from the appeal.
Good afternoon.
Good afternoon, Adam.
I guess my main question is why did the Department of Corrections decide on a partnership with CoreCivic in the first place, and whether you foresee discontinuing the DOC's contract with CoreCivic moving forward?
I am not familiar, Adam, with the process that went into the selection process for CoreCivic 2 years ago. I'm not familiar with that. I'm going to make the assumption that, like any request for proposal that goes out in state government, there's a vetting process that goes on to determine the best fit for what you're looking for as a result of the request for a proposal. Now, with that said, their contract does expire in October, and we have been starting the conversations about an extension of that contract. I am not in the position sitting here today to comment on how I think about that or how Secretary Smith or Governor Scott may think about that. My focus right now is putting the Department of Corrections team in Vermont totally focused on making sure we have the medical support we need on the ground in Mississippi. There'll come a point in time, hopefully in the next 10 to 14 days, 20 days, to start thinking about our relationship with CoreCivic.
Thank you. I guess just my follow-up question would be whether you know the origin of the other populations that are located at TCCF. What other states are they from?
I do not know that, and I think that's probably a better question for CoreCivic to answer.
Thank you.
Thank you. Take care, Adam.
Thank you, Adam. Mike Donahue, are you on the line? Mike?
Rachel, I've been in contact with Mike, and he's not on the line right now, but he's going to try to come back soon.
Okay, thank you so much for that update. All right, next up we have Emily Corbin from VPR.
Good afternoon, Emily.
Hi, Commissioner. So first of all, I was hoping you could specify the logistics about how we ended up being able to test the Mississippi inmates. Did Vermont send its own tests down to Mississippi?
We didn't in the end, Emily, but we were going to the point of potentially flying kits down there. But there's a problem with high altitudes with the kits, both prior to the collection and after the collection. So quite a bit of work went into this. After our phone call on Friday, once Vital Corps made contact with the Mississippi Department of Health, which was facilitated by members of the Vermont Department of Health, they were able to find testing capacity. And then they were able to get collection kits from around other facilities that they run in that area.
CoreCivic
was? We were able to collect enough kits, collection kits, to be able to get the job done. And we knew we had that in place at some point on Friday. I just can't remember the time.
And the ongoing routine testing that's going to take place down there, where will the tests come from for that?
We haven't worked that out yet, but we'll do whatever we have to do to include getting kits delivered there, drop delivered there. But we'll work that out. But they will become part of our rotation as a 7th facility, as we're doing, in fact, as we speak, Northern States was tested today on the rotation.
Commissioner, I wonder if you had asked CoreCivic or the state of Mississippi to test Vermont's inmates in Mississippi previously to this outbreak.
Not specifically, no.
Okay. Another question is, I wonder if you've gotten information back about the local hospital's capacity to take critical care patients.
We do have that information back, and Dr. Scott has been tracking that information along with Heidi Fox, our director of nursing. I saw it, Emily, briefly. I read it. I just don't have it here in front of me.
Sure.
There are 3 hospitals within a reasonable distance to that facility, a major one being in Memphis, Tennessee, which is a major trauma center. And so the ride from TCCF to Memphis would be the equivalent of the ride from St. Johnsbury to UVM when we were using St. Johnsbury as a surge site.
I guess what I was wondering more was like a yes or a no on capacity. Would an inmate at this point have access to an ICU bed if they needed it?
Yeah. At this point, they would.
Okay.
With the capacity that we have.
Okay. And that does it for me. Thank you.
Thank you, Emily.
Thank you, Emily. All right. Next up, Derek Brower, 7 days. We're about halfway through our list, just as a time check, and we have about a half an hour left on this call. So, Derek, you're up.
Hi, Jim.
Good afternoon, Derek.
Yeah, hi. I'm curious. You said before that there's, seemed to be this understanding or belief that there were capacity issues in Mississippi getting these tests for mass testing, but now it sounds like the state, in fact, hadn't previously asked to do mass testing. So I thought I understood it, and I'm a little confused now by your answer to Emily's question about why this wasn't in the rotation to begin with.
Because, as I said to you, as I said to the group earlier, there is limited capacity to test in Mississippi. The Mississippi protocol is to test symptomatic patients. That's just not in correctional centers. That's our understanding. Based on that, we had not asked to test based upon the conversation with CoreCivic, based on those ground rules and policies that were in Mississippi.
So so you sort of accepted at their word that this wasn't something they felt like they could do at the time.
Yeah, I guess that's the way to put it. I don't know if our staff validated that or not, but that's the conversations that we had with CoreCivic.
Okay. One follow-up then. What was the date of that first case at the facility, and why didn't that positive test trigger this request for mass testing?
I don't have that date in front of me. I can have Rachel get that for you. I guess the answer to that is that, again, it was one test with no one exhibiting symptoms in the facility. It was when the other 6 came back that when you do 7 tests and 7 out of 7 tests are positive, that caused us to immediately react here.
Okay, thanks.
Yep. And Derek, I'll follow up with you on that. Next up, Joseph from Barton Chronicle.
Good afternoon, Joseph.
Good afternoon. I'm curious, you were saying that you were looking at the population in Mississippi to determine who might be at higher risk of adverse consequences. And I'm wondering, what is the age range of the population down there, and what percentage of the people who are incarcerated in Mississippi appear to be at higher risk of bad consequences from COVID?
Yeah, thanks for that question, Joseph. The number that I have is 53. The department has a policy of not sending folks out of state that may have a chronic illness, such as a significant diabetes background or congestive heart failure. So when I say that folks are in a category of being at risk, in this case, the majority of them, as I understand right now, and I'm looking for validation on this, the majority of them is because of age range. I do not have the age range of the entire population there. I do not know what that is. But if you needed that, Rachel could get that for you afterwards. When I say that vulnerable people, we're basing that upon age.
So would you say that the cutoff would be 60, for example?
Yeah, in my mind, it's 60. And sometimes in situations where folks are incarcerated, a lot of folks at 60 are healthy in fairly decent shape. Sometimes our population doesn't exhibit that. So 60 is the number, and we're trying to get our arms around that population right now, and what their medical history is, and even if they're positive, negative, and we don't know their test yet.
Thank you very much. That's what I needed to know.
Thank you, Joseph.
Yes, thank you very much. All right, next up we have Bridget from the St. Albans Messenger.
Good afternoon, Bridget.
Hello. Thanks for having us on here today. My question is, did the Department of Corrections seek to bring Vermont prisoners back to Vermont early in the pandemic when this was beginning?
We have brought prisoners back, inmates back during the COVID. I don't have the exact number. Rachel could get that, but I know of at least 2 prior trips that came back. So that's a pretty normal ongoing process. We're at 219, the population now. I believe when I started as commissioner back in January, and don't hold me to this, I'll have Rachel get this for you, the population there was in the 260 range, 265, 270. So we have brought people back, and we've tried to bring as many folks back as we can. But if you're asking the question, could we bring them back, put them in our facilities and manage them here? The balance we have right now, and I know of a lot of people, even as late as the last couple of days, as a result of this incident, have opined the fact that they think we should bring everybody back. only if it was that simple. It's not that simple because of the space in our facilities, especially in the environment we're in around COVID-19.
Great, thank you so much. I was also wondering if you knew of the 84 positive cases, how many of those people are currently symptomatic?
We have none of them are, some of them are presenting some symptoms, but none of them are presenting symptoms that are concerning us about having to move them to another level of care.
All right, thank you so much. That's it.
Thank you, Bridget.
Thank you. And Bridget, I'll follow up with you on those questions. And Joseph, I'm sorry, I forgot to mention before, I will be following up with you on your outstanding questions as well. Next up, we have Alan from VT Digger.
Good afternoon, Alan.
Hi, Alan wasn't able to attend the press conference today, so this is Aaron Patanko from VT Digger. Is it okay if I ask a question on his behalf?
Of course. Welcome.
Okay.
Yeah.
Hi.
Aaron, did you say Aaron?
Yes, Aaron from VT Digger as well.
Good afternoon. Good afternoon.
I wanted to. Good afternoon. I wanted to know if there have been previous outbreaks in Mississippi prisons, and if you know if this is the largest in a Mississippi prison so far.
I do not know if there were other outbreaks in prisons in Mississippi. I'm assuming you mean all prisons in Mississippi, Aaron, by that question?
Yes. Yes.
I don't know that, because again, this is a private enterprise, and I'm not familiar with what's going on inside the state of Mississippi's jail system and or their county jail system. I'm not familiar with that. I don't know if this is the largest, but for me, being the person that's responsible for those inmates, you know, it doesn't matter if there was something larger or not. These numbers are very, very concerning to me.
I also wanted to know how much interaction do the prisoners from Vermont have with prisoners, you know, and the rest of the population? And are those prisoners getting any treatment in light of the situation? Because it seems like there could be a potential for, you know, continued contamination between groups, even if we're giving the Vermont prisoners more attention.
I understand. I've not been there. I'm going to have somebody make sure I'm right on this. Our inmates are in an entirely different part of the facility with no contact with any other inmates from other states or locations. Al Cormier, are you on?
Yes, sir.
Am I correct in that, Al?
You are correct in that. We do have some of our population that does work throughout the facility. So those inmate workers may have contact with some of the other jurisdictions in that facility, but as a whole, the Vermont population is kept separate from the rest of the other jurisdictions in that facility.
And Aaron, I'd like to follow up on a point that Mr. Cormier just made, is that this is why contact tracing that we, in partnership with the Vermont Department of Health, have developed quite an expertise in, why this has been so important with us working with the folks down in Mississippi to do that contact tracing. It's critical to identify who folks came in contact with and follow up on that.
What does that contact tracing look like in a prison facility? Because it occurs to me that prisoners must have a lot of interactions with people each day.
It's like any other, it would be no different than, Aaron, if you tested positive, and it would be starting an interview process with you to try to figure out who you've been in contact with, and then going to that person, figuring out who they were in contact with, find out the circumstances, put the science to it, if it makes sense to test other people.
Okay, I think that's all. Thank you.
Thank you, Aaron.
Thank you. All right, next up, Dom from WCAX.
Good afternoon, Dom.
Hello, can you hear me?
I can hear you, Don.
Perfect. I'm just wondering if there's any plans to, not necessarily Vermont to test, but is there going to be any sort of mass testing at this facility in light of the outbreak of the Vermont prisoners?
As far as the rest of the facility,
Yes.
I do not know that.
Okay.
We've been focused on our responsibility, which is the Vermont inmates. So I do not know what CoreCivic's plans are for the rest of the facility. They are testing staff, which is completely outside their normal protocol.
Okay, cool. Thank you.
Take care, Don.
Thank you, Don. Okay, next up we have Greg, County Courier.
Good afternoon, Greg.
Good afternoon, Commissioner. I'm wondering how this affects the contract with CoreCivic. Is this going to be an additional cost to the state of Vermont to do this testing and to separate these prisoners, or is that all included in the contract that Vermont's already paying?
I don't know, I have not read the contract, but making the assumption, and I can follow up on this with you, they have an obligation in the contract to provide medical care to the inmates that are Vermont inmates in their custody in Mississippi. And if it comes to a conversation, I would be reasoning with them that what they're doing right now is providing medical care to those inmates to keep them safe.
So that may answer my follow-up is, if one of these inmates needed severe medical attention, ICU bed, whatever, that would be covered under CoreCivic's contract?
I don't, that could be a different conversation, Greg. And what I'm going to have to do is get together with Rachel and our contract monitor that monitors the contract and get back to you.
Okay, and one other quick question here. Is it safe to say that if the prisoners hadn't come back to Vermont and been tested, we wouldn't have known that 85 prisoners had COVID down there?
I couldn't agree with you more, Greg. Our protocols that we've worked on hard here are what caught this. And I'm hoping it caught it early enough that we can do the right intervention, mitigation, and providing community level care to our inmates. But if we hadn't tested those 6 as part of our protocol, and we had just, first of all, put them into our population, would have caused problems here. But we certainly wouldn't have, as I like to say, put our coffee cup down and said, okay, what do we got going on here? And that's exactly what happened here.
All right. Quick clarification. CoreCivic, is that the only out-of-state housing that we have for prisoners? I was going through the jail tracker.
No, it's not. Great. We have about, I think the number I was provided earlier today is 33 folks that may be in various locations, and we're starting to do an inventory of that now to try to figure out. So the circumstances there are sometimes we have an inmate that may not be the right fit somewhere, or we have state compacts with other states where we do an inmate comes here from another state and we trade off an inmate to go there. That's a better fit for a system somewhere else. So we have about 33 people in other systems that we're identifying right now, but we have no clusters like we have with CoreCivic.
So with those 33 inmates, are you looking to do the same sort of testing that you're now realizing that you had to do with CoreCivic?
First thing we got to do is identify where they are and then figure out, we know where they are in our system. I don't want to make it sound like they're somewhere lost in our system. But we're doing an inventory right now to understand, for example, if somebody's at a federal institution, what are they doing around providing testing and so on? We're taking an inventory of that now.
All right. Thank you, Commissioner. You have a great afternoon.
Thank you, Greg.
Thank you, Greg, and we will be back in touch to follow up. And Malia, Burlington Free Press, you're up next.
Hi, Commissioner. How are you doing?
Good afternoon, Malia. How are you?
I'm good. I had two quick questions. One, does this incident impact the DOC's relationship with Mississippi, and does it change the nature of that relationship? In other words, will you be sending fewer inmates down there in the future, or vice versa? Will you be bringing more Vermont inmates back?
Well, clearly, until we get our arms around this, we're not sending anybody down there. We are in discussions of if we should bring some people back now, but that's challenging again because still fighting off COVID here. And your question about does it hurt our relationship? This is a business relationship between two groups, the Vermont Department of Corrections and CoreCivic. And at the core of any relationship that you have is trust. And as the commissioner, I'm going to have to evaluate the level of trust once we get our arms around this situation. And I'm not in a position right now to say one way or the other how I feel about that because we're too focused right now on taking care of those inmates in Mississippi.
And my follow-up question was just, when you mentioned that some are better fits for facilities outside of Vermont, is that solely based on capacity, or is that based on some other mechanism?
It can be a whole host of things. Programming. You may have somebody in our custody that's having a hard time getting along with other inmates or staff, and we want to make sure that they're in a setting that provides them the best fit. So there's a whole host of reasons why that happens.
Great. That was all I had for you.
Thank you.
Thanks.
Thank you, Malia.
Thank you. All right. So last question that we have in the queue, and just as a reminder, we have 10 more minutes on this call, and we'd like to be able to check to see if there's anyone else who may not have RSVP'd but is on here. Mike Donahue, the Islander, are you with us? Mike. All right. Is there anyone else from the media on this call that has a question that was not asked? You are allowed to unmute yourselves in order to ask.
Rachel, if no one else says, I just want to, there's something that I guess I wasn't clear on, not from the questions, but just reflecting on what I just talked about. And I think I did mention this. The Vermont Department of Corrections has been as successful as we have been about keeping the virus out of our facilities. It's just not the work that the Vermont Department of Corrections does. You know, the governor's been very clear on this. We test to suppress, and the testing allows us to quickly identify and suppress the virus. And a lot of, in jail situations, when you look around the country, the places where there's outbreaks is really directly tied to community spread. And, you know, that's why we've been so successful in Vermont, is that community spread is one of the lowest in the country, if not the lowest. And we have one of the lowest spreads inside the jail system in the country. But it's tied directly to how well we do in the community, and people follow the rules around wearing masks and social distancing, washing hands, and those type of things. So one of the things I learned today is that where our facility is down there, that community spread is very busy. And so it's something that once we get our arms around this, we're going to have further conversations with CoreCivic about, because it's the front door that you have to protect when you're protecting jails. So I didn't touch on that when I talked about action items, and so I thought I would just lay that out there. And I don't know if that spurns any other questions or not, but I wanted to put that out there.
Commissioner, this is Fred from the county courier again.
Yes.
Quick clarification on that. Are you thinking that CoreCivic may be able to move our Vermont prisoners to a state that maybe contains the virus better, or?
No, I'm not saying that at all. What I'm saying is, if you have, again, I'm talking in general terms, Greg. If you have community spread, what we do here in Vermont is, I'm in briefings often during the week with Commissioner Levine, and I pay very close attention if there's a cluster of an outbreak in a given area, and if we have a jail in that area, I bring that back to staff for us to raise awareness that there's a community outbreak, and we need to pay attention to that. I'm not talking about should we be moving people or not. I think it's a fair conversation we need to follow up with CoreCivic. That's what I'm saying.
All right, thank you.
You're welcome.
I have a question to that.
Sure.
It's Erin from VT Digger.
Hey, Erin, how are you?
Hi. Looking at the surrounding county real quick, it's relatively poor with 30% of the population below the poverty line, and it's almost 50% Black. Do you feel like there's a broader conversation here about kind of exporting our prisoners to the most disadvantaged areas of the country?
I think what I think, Erin, is anytime a question comes up, excuse me 1 minute, to me as the Commissioner of Corrections, about equity and how equity plays into our system, both internally and externally, I think it's a fair question. I don't have the answer to it, but it's a fair question. And your point is well taken, Erin.
I'd love to ask one last question. This is Emily Corwin.
Yes,
Commissioner, I'm just wondering who you hold responsible for this outbreak. Is it yourself and DOC? Is it Mississippi, the state, and their policies? Is it CoreCivic?
As the Commissioner of Corrections, Emily, I'm ultimately responsible for the Vermont Department of Corrections. And I'm ultimately responsible for those inmates in Mississippi. I'm not anywhere near yet looking to place blame. The focus right now is to get focused on making sure we're getting medical care to those folks that need it. With that said, I'm personally upset that we're where we are. And I first hold myself accountable, and then I'll have a conversation about where else we hold accountability. But Jim Baker, as the Commissioner of Corrections, is accountable to those inmates and their families and to the citizens in Vermont. I take my oath very seriously that when people are in the custody of the Commissioner of Corrections, that they're being taken care of. So I know that doesn't completely answer your question, but if anybody owns the blame on August 3rd at this point in the conversation, it's Jim Baker.
Thank you, sir. One last opportunity to ask questions if anyone has any.
It's Lisa from AP again.
Hi, Lisa.
Just so I'm clear, the 85, those are their final tests, right? Those have been confirmed as positive cases.
Is that the number, Emily? Emily. Sorry, going back to Emily, the last question. That is the number, Rachel, right? 85.
Yes, 84 of whom were tested in this round of testing of all inmates, one of whom was tested positive last week, and I know there's a follow-up on getting the exact date of that.
So Lisa, that's what's confused me. You're saying 85 because of the one prior test and the 84 that came back positive. Is that why you're asking that?
Okay, I see. And then, and you do have a few outstanding still.
That's correct.
Okay, thank you.
You're welcome.
Jim, when do you expect the outstanding tests to come back either positive or negative? What's the time frame on that?
We're hoping today, but again, if you're following the national news, the private labs are backed up. I'm optimistic we can get them today. Hopefully later, no later than tomorrow, because every day we don't know the situation and we need to be able to react to it.
We have time
Do you
for
expect to
one
release-
more question.
Do you expect to release that information if you get it today?
We will absolutely release it as soon as we get it. Give us a minute to digest it and react to it, and we'll get it out.
Okay, thank you.
You're welcome. Again, I think that we're running out of time here. I thank all of you for your patience. I thank you for participating today, and we will keep you updated and keep you posted about the progress of us managing this serious situation.
Thank you all for joining. We're going to post the recording soon. Everyone from the press, you will see a link in your inbox. It will also be posted on our website under the press release page and on the Vermont DOC YouTube page. All right. Thank you all. Everyone stay safe.
Have a great day. Be safe.